Hello, thanks for joining me today. I'd like to talk a little bit about fat transfer. With fat, the beauty of it is if there's some place you have extra that you don't want, we're going to be harvesting from those areas. If you don't have a lot, and particularly if we're putting in the face where we don't need a large volume, we can usually find some of the good stuff. It might be your hip rolls, it could be your inner thighs, your tummy, your arms. Oftentimes we're able to find a little bit. The beauty of fat is that it is yours, and an added benefit is that fat has lots of different yummy components to it, growth factors and things like that that can be very healing. When we put it in the face, we sometimes notice that it improves the quality of your skin. It can be very healing when we use it for breast reconstruction, particularly in areas that have had radiation injury. It can really normalize the skin. It can help the nerves to regrow. So there are a lot of sort of magical qualities of fat. But common areas where we're placing it, again, might be the face. So if you're someone that's been using fillers and you're having to keep coming in and spend money to have the fillers done, the face is a really great place to do the fat transfer. So if you think about it, fat cells are live cells. So they need nutrition, they need a blood supply, they need oxygen. So what we're doing is it's like taking seeds, these live seeds, replanting them in another part of the body. So the reason that the face is such a great place to do fat transfer is that the vascularity or the blood supply to the face is really terrific. And when we're transferring the fat, we're really just sprinkling a few seeds here and there, whether it's in the temples to minimize that sunken, what we call the peanut head look, putting it in the cheeks, along the jawline, the nasolabial creases or the marionette line. Those are all really great places to put fat. The face is a really, just a really terrific, successful area for fat transfer. Now, if we're talking about a fuller bust line or what's called a Brazilian butt lift or fat transfer to the buttocks, it's a little bit more of an ask in those areas because the blood supply in those areas is not as good, and we're really taking and dumping a big bag of seeds in the area. So I would say the percentage take in the breasts and the buttocks are maybe more in the order of 50 to 65%. In the face, it really tends to be maybe more 70 to 80%, but there's still areas that it can be done very nicely and very successfully. Sometimes patients will ask, well, are you at a risk for having one big boob and a smaller one because the take is different? We haven't really noticed that. Generally, we're harvesting from the same areas. We break up the fat into a little slurry so that it goes in smoothly. And so the take tends to be very symmetrical. Now that being said, if you have some asymmetry in your face or in your breasts or wherever it is, then we expect and anticipate to put more in the smaller side, and we can often get you more even than you may have started. Another really great area to do the fat transfer is the back of the hands. So if you look at your hands and you feel that they're very veiny, they're very sunken, you can really see those tendons in there, it can be very nice to smooth out the backs of the hands. If you have a scar somewhere where you have a depression from a scar, that's another great place to do the fat. So those are some things just to keep in mind with the fat transfer. Is can be really terrific. Some areas it's a little bit less predictable in terms of the amount of volume that would take, but it can also be very healing. There are a lot of really great qualities, and so anywhere you feel that you may have a deficit, fat transfer is something to consider. When we do the liposuction, depending on the amount of volume that we need, we might be doing it in the operating room under a general anesthetic with you asleep. We may be able to do it in the office. So again, that really depends on the number of areas, the amount that we're talking about, and that would be something that we would talk about during your consultation. As far as potential complications, really are from the liposuction standpoint and from the fat transfer standpoint, patients tend to do very well. The scars are pretty small. Usually it's just a small poke hole to put the fat in. It might be as large as a half a centimeter to a centimeter from the liposuction harvest site, but the scars we try to keep in natural creases or in areas that will be hidden. So those scars tend to do really well. Unfortunately, you can potentially get a little bit of lumpy bumpiness either in the harvest site or in the area that's transferred. Our techniques are much better than they used to be, so we don't tend to have those problems as much, but unfortunately they can still occur. I would say infections are pretty uncommon. Generally, if you get one, it can be treated with antibiotics, but unfortunately with any kind of surgical procedure, infections are a risk. Bleeding, bruising, particularly for the areas that we're putting the fat in, we would expect to have a lot of bruising because we are trying to, for the most part, get those fat cells near a good blood supply. But we would expect to see bruising in the areas that we've transferred the fat to. It's sort of plus minus in terms of the harvest site, whether you have much bruising or not. We'll often have you wear some compression in the fat harvested sites just to minimize bleeding, bruising, getting fluid collections in the area that we've taken fat from. We really want to minimize movement, touching, pressure to the areas where we've transferred the fat to, because again, like planting seeds, we want those fat cells to take, so we don't want a lot of disruption. So we're going to minimize pressure. If we do a Brazilian butt lift where we're transferring fat to the buttocks, we're going to really want to minimize the amount of pressure to the bottom. With fat transfer to the breast, really just a bralette or no bra until we've had a chance for those fat cells to kind of take. Other complications, like general complications from any kind of procedure, kind of mentioned bleeding. That's usually not a problem. You might get a lot of bruising, but bleeding that we have to go back to the operating room to take care of, I would say, is very uncommon. Infections are uncommon. Bad scars are uncommon. Having a fluid collection is not that common, but might be one of the most common issues that we have, where we might need to, if you get a little pocket of fluid, particularly in the harvest site, we might need to numb and put a little needle in to drain. You can get numbness, permanent numbness, weird feelings, not normal feelings in the skin or the tissue, but because we're not generally cutting into the tissue, those types of things usually normalize just with time. I would say those might be the most common or the worst types of complications that you can get, but overall we're really fortunate because our patients tend to do well with these procedures. So if you want to learn more and have a personalized consultation with us, please give us a call.